Good afternoon, ladies and gentlemen. Welcome. Now, when we were last here together just 2 days ago, I said we'd have more news today, and indeed we do. In the course of the presentation today, you'll have a full team. I said it was a slimmed down team last time. It's an expanded team this time. That's because we've got a lot of material to get through. But what I'd like to do, beginning, and I know I say this for all of my colleagues, is that we are so grateful to our community for the way that you've responded to these latest challenges. They are significant challenges, but we need you to continue to be vigilant, to continue to meet all the requirements that we've imposed upon you, which we've done very reluctantly, but of necessity. And we need you to help us to get through where we are now. Now, we will be announcing some changes, some limited ones effective tomorrow, some others that hopefully will be effective in weeks to come. There will be published shortly an exit from lockdown strategy, which will have 3 stages to it. So we're going to touch on some of the detail today, but as I say, that will be expanded upon when the document is published very shortly. Now, the framework will, once we're through all of it, we're finished when we get to stage 3 or phase 3, will be such that we'll be back in the bailiwick bubble that we were in from the second half of last year and up until the 23rd of January of this year. That's our aim. We aim to get there as soon as we can, but as soon as we can is coupled with as safely as we can. We're not going to rush things unnecessarily. We intended, and we still intend, that this bubble that will be established when we get back to it will be such that it will then be there for as long as can possibly be. We can't guarantee anything. But we want this lockdown to be as short as it possibly can be. We appreciate it's already now 2.5 weeks, and it's going to be some more weeks yet. Now, we agreed yesterday at a lengthy Civil Contingencies Authority meeting the way forward. Now, the time frame is uncertain. It will depend on factors. We would have wanted to move forward more quickly if it was safe to do, but we still have over 300 active cases, and the numbers, although going exactly in the right direction, are still such that we have to be cautious and careful in a measured and proportionate way. Now, the 3 stages will be, as I say, they'll apply throughout the bailiwick, but our colleagues in Alderney and Sark, and we're very grateful to the input that we've had from our colleagues in Alderney and Sark, may want to adapt the strategy to meet their own requirements of the islands that they live in. Now, those will be very much subject to their own good sense and judgment, albeit it will have to be reviewed by the Civil Contingency Authority, but we endeavour and expect to be able to work with that in a compliant basis. Now, we've made it very clear since these restrictions were first imposed on the 23rd of January that they will only be enforced for as long as is necessary, with the aim that we start to get out of this present circumstance that we're in as soon as is possible. Now, we agreed 3 objectives yesterday, and I'm going to read those to you, and they are as follows. Firstly, to open up the economy as quickly and safely as possible, prioritising businesses that cannot work remotely. Secondly, and perhaps there should be a but before that, but to do so in a way which contains the virus to the extent necessary to protect our valued health and care infrastructure, thereby reducing the risk of COVID mortality and the longer term impacts on people's health. And thirdly, to ensure that the steps 1 and 2 above are evidence-based and proportionate, because everything must be proportionate to the risk that we face. It's important to note that we get to that panacea, that cure of all ills, at least for the moment, stage 3, that we continue to be vigilant, as I say, and that we have to work through the other 2 stages methodically. We're making progress, and Dr. Brink will give you an update as to where we are with the virus in connection with her views as to what steps can be taken forward. Now, we are making some changes effective as soon as tomorrow, but we still remain in lockdown. Just because we're making those relaxations doesn't affect the overall ethos of what we're having to do. We will be reviewing where we are again next Tuesday with a further announcement next Wednesday. But the variations we can make with effect from tomorrow are consistent with the objectives. and they are, and my colleagues will give more details of that when they speak, the introduction of bubbles for certain groups of islanders who fall within categories that we believe should be particularised. And this is a very important and, the ability for lone workers or sole traders to be able to return to work if they cannot work from home, and provided their operations do not bring them into physical contact with others. So there'll be no contact with others, but there are lots of people that can go and work safely. And these are people who have been restricted for the last couple of weeks or so, but they must avoid any physical contact with anybody else. So we're giving that opportunity for businesses and small traders and individual workers to go and work, but we're asking you to respect the spirit of what we're doing. Now, these immediate changes are intended to get people back to work, as I say, who've been restricted for the last couple of weeks, because we want to get our economy back. It's going to be a gradual, attritional, progressive path that we're going to follow. Now, before I hand over to Dr. Brink, there's one more issue that I want to address. The subject of face covering and mask has been the subject of much discussion over recent weeks. Now, what we will be doing, probably from Saturday, but there'll be more detail to follow, but bear this in mind, it'll be Saturday, is make face coverings mandatory in public places. And again, my colleagues will give more details of that. As I say, full details will be published today, but Deputy Salisbury in particular will discuss that in more detail when she speaks. Now, I think that's enough from me. As I say, we are making progress. It is good progress. We wish it could be quicker, but there's an old adage, isn't there? A shortcut is sometimes the longest way round. And what we have to do is deal with this in a sensible and proportionate way. So, Dr. Brink, over to you.
So thank you very much, Deputy Fairbrash. And I'm going to refer to the slides now. So slide 1 is entitled Case Summary, and that gives you an update of where we are today. Now, we've had a total of 450 positive cases in this wave starting on the 22nd of January. So if you then look at what are active cases and what are closed cases, so just to remind you, active cases are people who currently have the infection. Closed cases, people who've recovered or sadly have died. What we've seen is that we have 336 active cases and 114 cases are now closed. Those 114 cases are closed because people have recovered. So a quarter of people that have been infected since the 22nd of January have now recovered, and we haven't had any deaths to date. And that's really encouraging. So we're pleased about that. So if I go to the next slide, which is entitled Slide 2, Case Breakdown, I'm going to show you some of the historical data going back a few days, but then also focus on the more recent data. So as you can see, from Monday the 1st, we had 30 cases, most of them contacts, but still quite a few unknown community source, 7 at that stage. Going down to Friday the 6th, we had 22 cases, again 17 contacts, and we had 1 unknown community source, but we detected the first cases in care homes, and I'll talk a little bit more about that. I'll talk about the further figures. So that just shows you how things have progressed between Monday the 1st and Friday the 5th of February. But what I want to now do is focus on the more recent days and explain where we are now. So if we go to the next slide, which is entitled Slide 3, Case Breakdown, and we look from Saturday the 6th to Tuesday the 9th. So what we see on Saturday the 6th, we had 9 cases, 2 of which were unknown community cases. But what I wanted to explain also is on Sunday the 7th, we had 21 cases. Now, what will happen over the next few days is the case numbers will bounce about. So if you look at Sunday the 7th, those 19 contacts were actually only related to 3 clusters. So we were testing around a cluster. So although the number seems large, we were using our proactive testing policy to detect those cases. So really important that the numbers over the next days will bounce around. So on Monday the 8th, we had 1 unknown community source and 10 contacts. And on Tuesday, we had 8 in total. And here you see we had 5 contacts but 3 unknown community sources. Now, what I want to talk about the actual contact tracing is when we contact trace, we can sometimes attribute a case directly to another another case. So we link those clearly together. What we've seen with those 3 cases that we saw yesterday, although we can't precisely link those cases together, what we have seen is that they're linked to areas that we know there's been COVID activity. So that's called source tracing. So we know there's a link through the source of the virus. So that's important for us because these are not cases that are springing up in areas that we are really concerned about because we can't find any link at all. But as ever, we can't be complacent. With regard to the care homes, in Care Home 2, we have detected another case. It is in a staff member, not in a resident. Person is very well and was a direct contact of that original case that was detected. That surveillance testing, very proactive, will carry on, but that's the update on the care home status. So if we then move through to slide 4, entitled Active Case by Type, what we then see is our movement over time, and I'm going to show you some of my more favorite information, which is the modeling. But this just shows you in a rather crude graph where we're going with both the cases, which is the unknown community cases, which are indicated in orange, and the contacts of cases, which are indicated in green. And what you can clearly see from that graph is both of those are plateauing off. So again, we're moving in the right direction, and I am pleased about that, and that's something that we can take forward. So if we then go to the next slide, which is entitled Slide 5, and that's about modeling the progression. And as you all know, I do love evidence, and I think anything that we do, we owe it to the community in the bailiwick to come back and share with you the evidence of what our interventions are. So this is our modelling graph, very like what we did in the first wave. And what you see from there, if you look at the green dots, those are individual cases. Now, particularly in a small jurisdiction with relatively small numbers, those numbers will bounce about. So what we then do is we use a 5-day moving model, and that's an indicator in the blue line, and that gives you a trend of what's going on. Now, what is really important in this graph, if you look at the grey dotted line, that shows the trajectory that we were on the 22nd of January, and we were on an exponential growth trajectory. So had we not intervened, we would have had an exponential growth of the number of cases. The amber dotted line shows us what would have happened if we had put in just some gentler measures, for example, just social distancing. So what you'd then see is you see a decrease in the number of cases, but then you'll see a takeoff as the cases, because you don't get rid of the cases in the community. So that's really important. So what you're now seeing as we move forward during the lockdown period, you're seeing we've really squashed those number of cases, and that's really important. So I think with regard to the modelling, I think we will continue doing this modelling and continue sharing this with you so you can monitor the progression as we move out of lockdown. So what I also want to discuss, which is on slide 6, which is entitled Our Approach to Exit from Lockdown, I wanted to refresh your knowledge on the criteria that we used for exit from lockdown. So we are indeed using some of the criteria we did the first time, and that's the test, trace and quarantine that served us very well the first time. It's serving us well now. The adaptive triggers, I'll talk a little bit more about the adaptive triggers in a moment. So those are the triggers that go forward and the triggers that would make us go backwards. We of course have our border testing and isolation policies, we had our isolation policies in the first wave, but that's been augmented by a border testing policy as well. So what we also had in the first wave was our testing program. What we're introducing as we move out of this lockdown is a very proactive surveillance program. So our testing will be a testing to look for acute cases. It'll be a surveillance to look for undetected cases in the community and people who are asymptomatic, but also we'll be using surge testing, which if we identify an area where there's some COVID activity, we'll then put extra testing on top of that to have a look whether there's anything else we should be worried about. So what's also different from the first lockdown, the exit from the first lockdown, is we're doing this with an implementation of a vaccination program. And so our population is going to be increasingly protected as in the months to come and as we move out of the lockdown process. So that will provide protection for the most vulnerable in our population. But we also have to take into account the fact that we're dealing with a different situation at the moment, in that we have the emergence of the variants, which we know are more transmissible, and indeed we've seen that in our community. So all of those things we've taken together as we move forward out of lockdown. So if we go to the next slide, which is entitled 7, which is slide 7, which is the approach to the exit from lockdown. Now, quite simply, the objective of lockdown was to reduce the mixing of people and so reduce the spread of the virus. It was a very simple objective. And as we move out of lockdown, what we've done is we've aligned the steps out of lockdown with our previous phased approach. But we're doing it in a slightly different way, in that we're looking at what lessons we learned from last time, but also looking at the situation we're currently in with a greater enhanced testing capacity and with our vaccination program. And we've got we're currently in lockdown, and I'm going to talk about some of the variations that we're doing with regard to the lockdown process. But as we progress out of lockdown, stage 1 will see then the introduction, for example, of social bubbles. It'll be a greater allowance for outdoor gatherings and some other measures to enhance the economy, to look at businesses and so on. As we go into stage 2, that would really be equivalent to our old phase 4. And here you're looking at social distancing in controlled environments, so people going into restaurants, leaving their name, tables certain distance apart, so all of those measures, and then an increased number of people that can gather together. So each step, we're looking at the economic impact and we're looking at the social impact, and we're balancing those together to progress out of lockdown. And then stage 3 would be when this current outbreak would be declared officially eliminated, and when we progress into what would be our old phase 5, which is the stage 3 in this document. So we've tried to align to the previous exit from lockdown, but also learn from the lessons and look at what the situation we're currently facing is. So if we go on to the slide entitled slide 8, which is the release triggers, I think you're all well aware of the release triggers we use, and these can be used to go backwards and forwards. So they include things to go forward. There are no new clusters of infection that we are worried about, that we can't control. And I remind you just of what happened in October last year when we had a cluster of infections. We were in phase 5. We didn't go backwards because we were confident that we could control that, and indeed we did. The adequate hospital and primary care facilities, but not only that, community care, emergency services and so on. The continued local testing I've talked about, diagnostic testing, surveillance testing and surge testing. We need to be able to do all of that. The surveillance program I've spoken about, the full rollout of the vaccination program, that is pivotal to protecting our community, absolutely vital to protecting our community. And of course, that public health adherence to the message, and which the community has done so magnificently. They've worked together, you've all worked together with us to get us in the place we're in now with regard to progression. And we are truly grateful for that. So if we then go to slide 9, and I'm just going to highlight a few things from full lockdown, which are going to vary this week. And there are 3 things, and some of these are going to be addressed by some of the other speakers. So support bubbles, lone working, and education. So with education, we've already had children of vulnerable and key workers go back into the school environment. Lone working is going to be addressed separately, but I also wanted to talk about the concept of support bubbles. Now, as ever in public health, we use quantitative data, what we can measure, but also qualitative data, what you, the community, are telling us. And we've been looking at the themes that have come into us. And one of the things that has been a recurring question that we've been asked is about people requiring just a bit of extra support in their living circumstances. So as part of lockdown, we're now introducing support bubbles. And support bubbles, you can see on the slide the criteria there. When you have only one adult living in a house with children under 18 years of age, so you can then bubble with another house. You then exist as a single household. You don't have to socially distance. You can travel in private vehicles together, but you can then exist as a single household. When there's only one adult carer, another important aspect. When there's a child under 1, we've had a number of people who've got children under 1, maybe got newborn children, who really would like to bubble with another household just to provide them with that additional level of support. a child with a disability important, and when an individual needs to move to another household to get the support they need. So all of that, these support bubbles are focused on the social aspect of our bailiwick and answering the questions that we feel that people have been asking us. And before I pass back to Deputy Fairbrash, I just wanted to say thank you so much to Alfie for sending me this wonderful rainbow. You made me smile, Alfie, and you've made my day. So thank you, Deputy Fairbrash.
Alfie, I thought that was Deputy Broad, but it's obviously Alfie. So I'm going to go to Deputy Salisbury in just a moment, but I'd like to again emphasise the point made by Dr. Brink that we're so grateful to our community. We're making the progress we are because of the sense of the community. Now, I'll be handing over to Deputy Salisbury, who will be dealing with many things. She's always the complete control of her brief. And one of those will be the update for lone workers and traders. More information about face covering and mask, etc., and also about changes that we're thinking about and hoping to implement shortly. Heidi.
Thanks, Peter. Now, while it has been important for us to have had this hard lockdown for the last 2 weeks, ensuring as many people as possible stay at home, and although we can't move to stage 1 of the exit framework just yet, we are conscious of the low risk that lone workers and sole traders pose to the onward transmission of the virus, as long as they strictly adhere to the principle of working alone. That means exactly what it says, carrying out work where you don't come into contact with anyone else. Now, since we went into lockdown, people in the bailiwick have been asked to stay at home, except for carrying out essential shopping for food or supplies, essential work, seeking medical care, or for up to 2 hours of recreational activity. People have been advised that they must work from home if they're able to do so, and that position remains unchanged. However, from tomorrow, lone workers and sole traders who aren't considered essential workers may also return to their place of work if they're the only person present on the premises and they have no physical contact with colleagues, customers or clients. For those who work in outdoor trades, this means that lone workers and sole traders may return to offices, workshops or other premises. This may make it possible, for example, for non-essential retailers to fulfil and deliver or dispatch orders received online, as long as they can undertake work without any contact with other individuals, whether colleagues, customers or clients. For those who work in outdoor trades, this means that lone workers and sole traders may return to property and building maintenance, gardening and horticulture, and fishing or other maritime trades, as long again as they can undertake work without any contact with other individuals, whether colleagues, customers or clients. Restaurants and takeaways must remain closed for now, as these initial changes are purely aimed at those single-person operations that pose little risk and can resume activities safely. While we can't at this stage say definitively when we'll move into stage 1, we will be reviewing things next Tuesday in the hope that we can do so from the 18th of February. Now, this is the earliest we'll move to stage 1, but we're publishing details of the various stages today so you can understand where we hope to be heading, and businesses can begin making relevant preparations ahead of those stages being put into effect. Stage 1, which, as I say, could start next week, we'll see the return of something we're all familiar with from our previous efforts to ease out of the first lockdown: 2 households bubbling together. Now, this was considered the most appropriate next step, especially as we've done it before and people are familiar with it. Although we do understand this can cause difficult decisions for some, we hope it won't be for long. Stage 1 will also allow for gatherings outside of no more than 5 people, and non-public facing workplaces will be able to operate with up to 10 members of staff at outdoor sites and 5 members of staff for indoor sites where the work can't be done remotely, where social distancing can be observed and sufficient hand washing facilities can be provided. Just to be clear, only business operations that are not customer facing will be able to open in stage 1, other than those already in operation because they're deemed essential. Deliveries and takeaways will be able to operate within stage 1 parameters and requirements. Now, there will be a requirement on businesses to notify the states of their intention to operate and to maintain records, demonstrating that they're working to a clear method statement, just like last time. We'll make sure clear guidance on the mechanism for doing so is published in good time ahead of stage 1 coming into effect. Now, the last area I'd like to cover off is to provide more detail on the decision that Deputy Fairbrash mentioned regarding face coverings, and it being mandatory from Saturday for face coverings to be worn in indoor public spaces. So what do we mean by public spaces? Well, we're referring to the likes of shops, supermarkets, pharmacies, banks, post offices, petrol stations, GP surgeries, and also public transport such as buses and in taxis. This will be enforceable in law now, so please make sure you wear them. Separately, we continue to strongly advise face coverings are worn in outside spaces too. We recognise that it's simply not practical to wear a mask when you're exercising vigorously, and indeed the World Health Organization doesn't recommend it. But we do ask you in those circumstances to please keep your 2 metre distance from others. There are, of course, exemptions, and these include all children under the age of 12. It will not be compulsory for children under 12 to wear face coverings, but again, our recommendation is for them to do so if they're able. Other exemptions include if a person cannot put on, wear or remove a face covering because of a physical or mental illness or impairment or disability. If putting on, wearing or removing a face covering will cause a person severe distress. If a person needs to speak to or provide assistance to someone who relies on lip reading, clear sound or facial expressions to communicate, or if wearing a mask will cause distress to the person someone is assisting. You do not need to wear a face covering in your own car. Now, face coverings will be worn in schools in line with advice provided by Public Health, which strongly recommends they be worn where appropriate by secondary age students and adults. Now, face coverings are largely intended to protect others, not the wearer, against the spread of infection because they cover the nose and mouth, which are the main confirmed sources of transmission of virus that causes COVID-19. You can buy reusable or single-use face coverings. You may also use a scarf, bandana, religious garment or handmade cloth covering, but these must securely fit around the side of the face. Face coverings should be changed regularly, every 4 hours if possible, or sooner if they become damp or if you've touched them. And further details of this change will be published on our COVID website shortly. Thank you.
Thank you very much, Heidi. Clear as usual. Thank you. Over in just a second to Deputy Brouard, who will update you in relation to the hospital's preparedness, and he'll give some important messages about community behaviour. Al.
Thank you very much, Peter. Good afternoon, everyone. Following the discharge of a patient yesterday, there are currently 8 individuals with COVID-19 within the hospital. 2 receiving intensive care treatment in the Brock Ward high dependency area, and 6 in Brock Ward itself. Included within this 6 are the 2 COVID positive residents from the Grand Lawn residential home, who I'm pleased to say remain well. Other residents from the home are being well cared for within the hospital, and all are continuing to test negative for COVID so far. I would like to thank all the staff involved in supporting the home and its residents at this time. We remain prepared to expand hospital capacity if needed. If intensive care demand rises, we are ready to establish the overflow intensive care unit on the day patient unit, and this could be operational in a couple of hours. While urgent surgery is going ahead, I know that over the last few weeks, clinicians have had to make difficult but entirely necessary decisions to postpone elective surgery, and I thank those affected for their understanding. Building on messages from previous press conferences, I'd like to stress again that as a community, we have a responsibility to each other. If you experience symptoms, however mild, you must seek testing. Please do not go to work. It is very irresponsible. And I'd ask all employers to reiterate this message within their staff. And also, if you're considering going to the hospital for any reason, please be very careful that you make sure that if you have any symptoms, you report it well before you come to the hospital grounds. Finally, vaccination is continuing, and we'll be providing an update on the latest figures during Friday's briefing. I'd just like to make one extra comment, if I may. If you do have a dog and you're out walking, please keep it on a lead. It's really important to keep that social distance without having to retrieve your pooch from someone else's legs. So thank you very much, and back to Peter.
Thank you very much, Al. And just making a point that Al has made, somebody contacted me, and I think very pertinently so. Naturally, there are lots more people out walking, and there have been people walking with their dogs at Plymore. And there was a particular incident last weekend where sheep were chased through fields, through a garden, through an electric fence, and ended up on the road. And it took people hours to get the sheep back to where they should be. And there have been further incidents since. So please, 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 in this small island, respect the rights of others and make sure that your dogs are well under your control at all times, because it's important. And as I say, it's the sheep shouldn't be attacked. Nobody should be pressured in the way that they were, and the people had to spend their time, as I say, shepherding the sheep, if that's good English. Anyway, finally, to our Chief Executive, Paul Whitfield, and Paul's going to give you some operational updates and say how we're going to move through the stages. Paul.
Thank you, Deputy Fairbrush. Good afternoon. As colleagues on the panel have already announced today, there are a number of changes coming into force that will have an impact on the community. The announcement that face coverings will be mandatory inside public buildings means that it will be possible for those not wearing face coverings to be stopped and issued with a fixed penalty notice. Law enforcement officers will have the authority to issue fixed penalty notice of up to £100 if they identify breaches regarding face coverings. So again, please follow the rules, which are for everybody's safety. As Deputy Salisbury has stated, there will be exemptions in place. If you qualify for one of the exemptions listed, we are developing several mechanisms to help you evidence that. We are working with the essential retail sector, who will have stocks of sunflower landlords for those who declare within those shops that they qualify by way of an exemption. We're also working on a printable exemption card that members of the community can carry. This is in development and will be available from our COVID website shortly, but ahead of Saturday's implementation. There will also be an image that is sized appropriate for phones if people want to be able to display the card that way. We are working with the third sector partners also, who will be distributing different colour lanyards and advice to their members and service users that may have specific reason for exemption. We thank them for their continued support. Finally, we're setting up a desk at Beausejour so that people who qualify for exemption can collect a lanyard. This won't be available today, but will be in place tomorrow and be available in line with the opening hours of our community vaccination centre. Please note the lanyard and the exemption card will be on a trusted Guernsey Together basis. There will not be a legal requirement for someone to carry a formal doctor's letter, though if you already have such a documentation, you are encouraged to carry this with you. Guidance around all of this will be published shortly in advance of the compulsory wearing of face coverings coming into effect from this Saturday. The move to permit lone workers to start to operate clearly targets those who are really low risk and allow them to get back to work where they can. This is specifically for those that cannot work from home but can work without coming face to face with contact with customers or indeed other colleagues. As the CCA has decided, for the benefit of these businesses to implement this quickly, there will not be an immediate need for lone workers to apply for a permit system. This will be required when we move into stage 1, when more businesses can operate. And to clarify, that permit system will include sole traders and lone workers. And we hope, as we've said, that this may commence from the 18th of February, but we need to watch and see what happens over the next week. However, please take this in the manner it is intended. As Deputy Fairbrush has already stated, slow and steady will win the race, and we are still doing all that we can to control this latest outbreak. Further information about the different stages will be announced at future briefings as we bring more things into play. Testing continues at both the Princess Elizabeth Hospital and at the East Arm of the Harbour. Decisions on who should be tested are based on advice from public health and in line with the current testing strategy. This is so that we can make sure that those who need to be tested can be done so promptly. We're acutely aware how quickly the virus can spread. Particularly, we've seen in this wave, it can move through whole cohorts of the community, For example, in schools, we have seen it move more rapidly through pupils, school staff and parents, and indeed onto grandparents. As a result, we'll be using a surveillance testing strategy to ensure those environments continue to be safe for those who attend and work there. We will continue to use the East Arm as a primary non-clinical testing site. 392 tests were completed on that site alone yesterday. But we may need to respond to adverse weather warnings, which we are watching very closely at the minute in this cold snap. We may have to move to the ferry terminal or the airport facility at short notice, which would affect our testing capacity. Please make sure that if you are coming in for a test, you follow the instructions on arrival carefully. Work at the community vaccination centre continues to go smoothly. We've been getting some really positive feedback from those who have been in for their vaccine. Please remember to wear a face covering and bring your confirmation letter to your appointment. We've had a few people worried about the adverse weather. It's important that you make your appointment, but if the weather does get really bad and you're worried, then please give the helpline a call. As always, our thanks go to the teams who are working hard around the clock across all our facilities to manage the COVID crisis.
Indeed.
Thank you.
Thank you very much, Paul. Ladies and gentlemen of the press, it's now your opportunity to ask questions in the normal way. So have we got any questions from anybody? I'm looking at the screen. Yes, it's the Guernsey Press first. Juliet.
Good afternoon, panel. Thank you very much for giving us details about the exit to lockdown document. I've had a quick look through it because we've only had it for a very short while. I couldn't see anything in there about the possibility of what stage schools might reopen. Is there any idea of when that might take place within this exit framework?
The position in relation to that is we will clearly liaise with the education department well in advance. We'll take their advice, we'll take Dr. Brink's advice, and we'll look at matters. Dr. Brink may comment just in a moment, but we're not going to say it's stage 1 or stage 2 or wherever at the moment. It really is a matter of judgment going forward. Dr. Brink?
So thank you, Deputy Fairbrash. I think that is a question that everyone wants answered. I think as we progress through stage 1 into stage 2, in stage 2, there might be, in discussion with education, some a broader opening of school to include, for example, phase start, classroom bubbles, and so on. But that detail is still to be worked out. So for the moment, it remains for key workers, children, and children who are identified as being vulnerable.
Thank you. Matthew Leach.
Hello, Matthew Leach here from the Bailiwick Express. Good afternoon. This is a question for Dr. Brink. Jersey has released a list of other symptoms to look out for, including rashes and conjunctivitis. Should we be aware of these too?
Yeah, that's the latest World Health Organization update, and we're busy updating our website. We've actually been there's been a lot of data out on rashes particularly, and we've been using that as an indicator, but it's now been formally included, and we will be as well. But it's something that we've already been using in our clinical approach.
Thank you. Ewan Duncan.
Hello, good afternoon. I wondered, in the absence of Dr. Raby, if you could tell us, Dr. Brink, about the measures being taken at the hospital in regards to the isolation wards. We heard sort of last year in cruise ships, people were getting COVID symptoms from the air conditioning, and I wondered if this would be something which would be similar at the hospital and what measures have been taking place.
Dr. Brink.
So thank you very much for that. The air conditioning and so on within the hospital fulfills the standards that we need to look after patients with COVID. So the environment within the hospital is safe. All of our staff are using PPE. There's distancing between the beds, all of that. So the environment within the hospital to look after COVID patients is safe.
And I think actually Dr. Raby said that at the last briefing. Because somebody asked a similar question, and he explained that very clearly, that is safe. It all works perfectly properly, and it isn't a concern. I'm just saying, I'm seeing the same people got their hands up. Juliet, I'll come to you again. I haven't seen Hamish or Jim Delbridge yet, but they may have a question afterwards. But Juliet, your question.
Yes, thank you very much. I'm not sure if it was mentioned during the briefing, so I apologise if I missed it, but can I possibly check the total number of vaccination doses that have now been given? And also, I believe Deputy Broad in the last few conferences has said he's hopefully going to get a live system updated so we can see in more of a live way how many vaccinations are going to come into place. Do we know when that's likely to go live?
I'll come to Deputy Broad, but I think Deputy Broad said again in his statement that he's going to give that more information on Friday. Is that right, El?
Yes, indeed. More information on Friday. We had hoped we would be slightly further ahead with the figures, but unfortunately not. Other events have slightly overtaken us, but it's very much still our intention to be publishing the figures on a regular basis. And certainly on Friday, we'll have a much better update.
Does that answer your question, Juliet? Because I think you had a second part to your question.
I was just hoping to see if we possibly had a total number of how many doses have been given so far as of this week, or will we only be getting those on a weekly basis on the Friday?
Well, you'll be getting those on the Friday as Deputy Brewer's explained now twice that the figures will be given. He'll update them on Friday, and he's explained why. Jim Delbridge.
Thank you, panel. Jim Delbridge here from Island FM. This week, Carers Guernsey asked that carers within the community, especially maybe sons and daughters of elderly parents who maybe don't live with their loved ones, be moved up the priority list for vaccinations. I understand there's been a favourable response from the states on this. I was wondering when details would be revealed and who would be included in this move, please.
Dr. Brink.
Thank you for that. I think it's important to clarify carers have always formed part of Priority Group 6, and it was always our intention to include this group in Priority Group 6. So it was part of an initiative that we'd already started. So the groups that will fall into that are the obvious groups, for example, people in receipt of a carer's allowance. But we're doing a piece of work that's looking a bit more broadly. So we're working with our children and adult social work services to see if we can identify any other carers through that mechanism. And in addition to that, we've already started vaccinating carers who people are living in their homes, and the vaccinators are going into the homes to vaccinate the person who requires it with regard to age or so on. And if there's a carer there, we're immunising them at the same time. So actually that process has already started. The Department of Health in England is looking at producing a more discrete, a more confirmed definition of exactly what a carer is. And of course, we'll look at that. But we didn't think that we could wait for that definition. So as I said, we've already looked at carers allowance, the groups that are identified by adult and children's social care, together with those that we identify through our community nursing service when we go into people's homes. So that work's been ongoing for quite a few weeks now.
Thank you. Hamish, you've got a question.
Yes, Hamish Ausgrave from ITV Channel. I wonder if you could flesh out some more detail on what would have to happen to delay stage 1, and in turn where you would hope case numbers to be in order to trigger move into stage 2.
Well, I'll ask Dr. Brink about the case numbers in due course. I don't think that'll be the only factor, but it'll certainly be an important factor. But to trigger phase 1, we'd have to believe that we'd made really good progress with the outbreak, and that the controls were such that they could be continued without undue restriction. But equally then that we could go to phase 1, which has been explained by my colleagues. So the point is, it's a judgment call that we'll be making on Tuesday of next week, as Deputy Salisbury said. It will be influenced, amongst other things, by figures and Dr. Brink. But we're not going to say, I don't expect Dr. Brink to say, but it's up to her. She's the expert. If we get down to 200 by then, that's the right figure. I think there are other factors. Dr. Brink.
Yeah, I think that's absolutely right, Deputy Fairbrash. So actually, if you think about the situation on Friday, the 22nd, we had 4 cases. Now, those 4 cases were of extreme concern to me because they were completely unlinked, and that triggered us going into lockdown. Now, we might have 20 cases which are linked to a cluster that we know about that are in self-isolation. They wouldn't be as so much concern to me. So I think what we need to do is we need to look at the definitions, which are cases that we don't think we can control by our track and trace system, which are just popping up on a random basis. Those are the ones that will concern us. So it's rather the characteristics of the case than a numerical value that is so important to us as we move forward.
Thank you. Ewan Duncan? Ewan, have you got...
Yeah, sorry. I wondered if you might be able to give us an update on the numbers of cases that have been linked to the dance festival and also the Shipping Crown pub. I know previously you'd said that one case was linked to the dance festival, but we've heard of at least 4 cases. And based on what we found from these instances, how will that change what what restrictions are in place once we come out of this lockdown?
Dr. Brink?
So, to my knowledge, there are at least 6 cases that are linked to the dance festival. So a number of cases, and there's some more tentative links as well. So I think that's important, that there are definitely cases linked to that. Now, with regard to how it affects how we come out in lockdown, it's exactly why we're doing a phased release. We're not just going, well, we've suppressed the number of cases, let's go out of lockdown back to where we were in phase 5. So it's that staged approach. And if you look at it, it's only stage 3, which would get us back to the old phase 5. So I think it's really important that we have that slow progression out of lockdown. And whilst we do that, we back it up by a very active surveillance program. So if any cases pop up, we can jump on them, contact trace around them, surge test around them, and try and extinguish them.
Heidi?
Yeah, I think Nikki's very much covered what I was going to say, that last bit, but also linking it to the fact I'm sure people are concerned. They think, dance festival might have had something to do with this. Does that mean that we won't be able to have big events and things like that in the future? But as Nikki said, this is we are looking at that final stage 3, moving to where we were before the 23rd of January, but having that really strong surveillance programme alongside it.
Thank you. Jim Delbridge.
Yes, panel, thank you. Are there any plans to increase the opening or operating hours for the vaccination centre, maybe from 8 till 8 p.m?
Well, I hope whoever gets their call answered. Dr. Brink, I think I know the answer to the question, but over to you.
We could open the vaccine centre 7 days a week. The point is it's vaccine supply. It's not the ability for us to open the vaccination centre. We'll open it as much as we can to deliver the vaccine. So it's all about vaccine supply. There are no constraints on the time openings.
Yeah, that's the point that's been made before. If we had more vaccine, we'd be able to open more hours. There's a capacity to do it. There's just the vaccine to do it. Matthew Leach.
Yes, I have another question regarding vaccines. According to the JCVI guidelines, prioritising of occupational vaccination in phase 2 is a matter of policy, not something the JCVI can advise on. Who is deciding the priority list for occupations beyond frontline health workers, and will this information be available?
Heidi, do you want to take up that? Do you want to comment on that?
Well, I think it's Matthew talking about phase 2. So once we've got through all the category up down to category 9, that will be a policy decision, and that will rest in discussions probably with CCA. But that's something we have yet to decide. But I think it was Professor Van Tam mentioned it today. I think he was doing a briefing with the public and said exactly that.
Right, who's next? I think Juliet Puter.
Yes, I think we've been quite lucky in Guernsey that obviously mask wearing has been taken up very well by the public. Obviously, bringing in the mandatory restriction, I mean, how will that be policed? Do we expect to see police officers at our supermarkets or something like that? I mean, how's that practically going to work?
Paul?
I think Juliet makes a really, really exceptionally good point that largely the community has embraced the wearing of masks, particularly in most retail food outlets, and indeed adhering to the sort of strong guidelines that are being given about wearing them even in outdoors in close proximity to others. This is belts and braces. We are taking very seriously how contagious the virus can be, and it's just been thought that actually we just need that final notch on the belt to make sure that people are really aware that we're serious where people are by default coming amongst others, such in the supermarket setting, even though we're adhering to social distancing, that it really is highly and strongly and beneficial to be wearing face coverings. So again, it's just a belt and braces. In terms of enforcement, of course, we would expect most superstores, as it is now, where people go into shops and people are asked to wear a mask, they do. But the extra notch in the belt is people will be fined if they are reported and they're knowingly not wearing a face mask and they have no exemption or other reason not to do so. And we now have the regulation and the powers in place for law enforcement to be able to do that.
Ewan Duncan.
There's an interesting thread on the Facebook stream just now, which is from someone who is elderly. They're 80 years old, and they are currently living in Guernsey because of the border restrictions and I suppose to be near family. Yeah. They're obviously not eligible for the vaccine at the moment in Guernsey, but is there a point that we'll come to where I know that we obviously have a limited number that just for bailiwick residents, but for those people who would be in a vulnerable category, but of course they can't travel back to the UK now, will there be a point where we can say, look, we're going to vaccinate you and we can speak to the UK about that?
The answer is yes, but over to Deputy Broad first. Al?
Thank you, Peter. Yes, there is obviously a slight change of position, I think, from the island's point of view. I think the more we've looked at it, the more reason we've seen that we need to bring forward vaccination for those who happen to be in our community from other communities. There's a very strong moral argument with regard to, having a 90-year-old or an 80-year-old who's over here who is just as vulnerable to get the disease as any local 80 or 90-year-old. We also have the issue as well when we consider our hospital. We are trying to prevent people coming in from into hospital or needing hospital care. And it's just as likely that a Frenchman or a German person would catch the disease as well as an English person or a Guernsey person. So from that point of view, to protect our hospital, I think there's a very good argument for us to bring in the vaccination. There will be something brought to the CCA very shortly on this, and then we'll look at how we can roll it out. And also we have to consider that the vaccination that we're having here is courtesy of the UK and their residents. So I think there's a very good argument that we should be vaccinating people who are with us.
Thank you. Hamish, I'm not inviting you to ask a question in the sense of, but I don't see your hand up. It may be something on my machine. Have you got a question?
Yes, I think the hand is up. Sorry, maybe some technical issue with that. It's a question for you, Deputy Fairbrush, and Deputy Soulsby from Policy and Resources. Yesterday, Deputy Mark Hellier said it had never been the intention of Policy and Resources to publish details of individual claims for the payroll co-funding support scheme. Yet on the state's own website, when businesses try to apply for that support, it asks them to accept the statement. It remains the intention of Policy and Resources to publish information of those organisations claiming financial assistance. Do you accept that the wording of your own policy has caused some distress for some businesses over the last 2 weeks?
Well, Heidi and I have discussed that, in fact, today, amongst other things. The answer is yes. We did make a mistake. I'm the president of Policy and Resources. Ultimately, as a president of any committee, the responsibility is mine. I apologise unreservedly to those that have been distressed or inconvenienced. Let me just see, where are we now? Juliet. Hello, Juliet.
Yep, no, sorry for the slight delay there. I had another question in relation to the exit document. I'm not expecting this to be something that I'd like to change anytime soon, but I'm just keen to try and see where it fits into the various stages. We've obviously currently got the travel permit in place to try and ensure people only travel into the island if they have a permit granted by public health. And obviously there's an advice against all non-essential travel. At what sort of stage within the exit document are we expecting that possibly to change, or will that be affected by what goes on outside the island rather than inside?
Well, I think it's going to be affected. Sorry. No, Heidi, I've spoken enough. Heidi, you've got your hand up. You speak first.
No, I was going to say the document we're releasing is about getting out of lockdown. And as we can, then we worry about what we do with our borders afterwards. But they're two separate aspects. At the moment, we're dealing with the outbreak and lockdown and getting out of it. The borders is something that's constantly under review. And of course, it links very closely with what's going on around us. the UK and elsewhere, but particularly the UK, the success of their vaccination programme and getting their numbers down.
Thank you. As Dr. Brink was nodding, so I don't think we need to bring her in on that point. Matthew Leach.
Hello. Yes, we had quite a touching email from a member of the public who's missing his wife, and he had a question for the CCA. Why can care workers who have had their second jab move in and out of care homes freely, but members of the public can't? Or family members, I suppose.
Yeah, I understand what you mean. Yeah, Dr. Brink.
I think that's a really, really tough question, and I find those emails incredibly distressing and incredibly touching, and I think it's a very difficult situation. We're in the middle of an outbreak at the moment, and I just think we need to get over this outbreak, but I do think that connectivity needs to be looked at as soon as possible. But at the moment, because of the situation that's going on, we have to do what's safest. And there is a specific care home cell that looks at this on a very regular basis, and it's a topic that they're acutely aware of. And I think it's a topic that is quite frankly heartbreaking.
Thank you. Ewan, you've got a question?
Yeah, a question about Alderney and Sark. Obviously, we know how reliant they are on Guernsey for medical treatment, and I'm not suggesting they should move out of lockdown, to any extent of the freedoms that we enjoyed before. But is there an argument that they could move slightly ahead of Guernsey's lockdown by a couple of stages, just because, we know there are no cases there. Well, there's one in Alderney, but they are in self-isolation. So things are slightly different in those islands to as they are in Guernsey.
Yeah, I thought I did that. Sorry, Ewan, I couldn't have made it clear enough in my opening remarks. Indeed, we had a detailed discussion with our colleagues from Alderney and Sark yesterday, and they raised those points. And yes, that is the case. We will be looking at that in consultation with them, and they might well say, for example, can we move from phase 1 to phase 2 now, whenever now may be, when Guernsey isn't ready? And of course, that will be considered. So yeah, I mean, a very valid point, and the answer is that has been considered. Again, Hamish, I'm not sure. It's not your fault. There's technical. I can't see if you're asking a question. Have you got another question?
Sorry, yes. If I can ask about the comments that the UK Transport Minister made today, Grant Shapps. He told people not to book a holiday this summer, either at home or abroad. Would you be willing to say the same sentiments to members of the bailiwick?
I think in relation to that, there's no point leaving Guernsey if you can't go anywhere. That's not a very sensible statement, but you know what I mean. I think it's going to be very difficult indeed, and I'm expressing my own view. I've not discussed it with colleagues because Minister Shapps's comments, as you say, were very recent. I think it's going to be very difficult for people to travel at all in the coming months. This is so fast changing. They've got massive problems elsewhere in other jurisdictions. And what we want to do when we come out of this lockdown is make sure, if at all possible, we don't go back into another one. Matthew Leach.
I have a question about bubbles here. If you create a support bubble tomorrow, will that count as your chosen household bubble in stage 1? Are you, for example, stuck with yes, but with your first support bubble, for example?
Well, I see Deputy Salisbury nodding. I'm going to ask her and then Dr. Brink.
Well, Nikki might say I'm wrong, but I think it will. I mean, what we're trying to do is not increase the number of people linking up with each other, but what we want to do is try and make it as early as possible for those people who actually it will really help them. And that's why we're doing it just for those people now.
You need to add anything, Dr. Brink?
No, that's absolutely right. It's focusing on a specific need that has been raised to us, that there are specific groups of individuals who would benefit from earlier support. And so that's why we brought in the concept of support bubbles. But no, they won't expand in stage 1.
Ewan?
A couple parts to this question. Obviously, we know the UK brought in new rules about travelling there, which would be a 10-day isolation. Again, will these rules apply to those in the Channel Islands, for those maybe going to medical appointments or for compassionate reasons? And also an update on where we are with quarantine hotels, which I know was talked about last week.
Yeah. Heidi, do you want to deal with some part of that?
Yeah, I believe in terms of the announcements made yesterday, it will really only affect those people who are transiting through the UK from a red list country. So anybody who's doing that will have to isolate for 10 days in the hotel before they come back to Guernsey. and they will then have to isolate for the 14 days under our rules, unfortunately. So that will be the case. So just the people that are transiting through the UK, not people with medical appointments in, say, Southampton or anything like that.
Okay, and he also asked about isolation hotels, because we have discussed that at some length, haven't we?
We have discussed it, and probably looking at now is probably not the time to do it. We are keeping it under review, but we think probably now is not the right time to do it. But as I say, it's still there. We'll still think about it at the appropriate time.
And I think also we could say that we may bring other measures in relation to, again, maintaining controls about household isolation, etc. Those are all under discussion, and we're thinking about those. I think there was a question from Alderney about Dr. Brink. I think it's really for you. We had the one case in Alderney. Do they need to be concerned? Is that under control? How can we do our best to ensure that one remains one?
So I think citizens of Alderney are already doing so much to ensure that one remains one. So that, first of all, to answer the first question, yes, the situation is under control and everything's been done to contain further spread of the virus. The person involved has done everything that they should do, and the rest of the citizens of Alderney need to adhere to the rules of social distancing, only going out when it's required, work from home, all of that type of guidance or requirements that we put on. So I think that's important. So yes, they're doing everything they can, and I think that means that the situation is controlled there.
Thank you. I'm just saying, Matthew Leach.
I apologise if I've missed this, but will mask regulations continue throughout the stages?
Yes, they will. They'll continue until they are revoked. I mean, they may well be. It may be when we get to a stage where we say that we'll rescind that. But the current answer is yes. Hamish, have you got another question? Or I'm going to say I'm just asking because for some reason I'm saying everybody else's is not you.
No problem. I had a question from a viewer asking in which stage would elective surgery be able to restart?
Al, are you able to help us with that?
Thank you. Yeah, it's under constant review at the moment. There has been some elective surgery, as I understand, but unfortunately at the moment that's been all being postponed. But as soon as we can get it back on safely, it'll be back on again.
And I think another question from Alderney is, I think it follows on really, or is part of the previous question. Do we know anything more about the origins of the case in Alderney? And does it have any implications for the management of our borders? I think you've probably covered most of that, Dr. Brink, haven't you? I don't think there's much more to say.
It was detected through a contact tracing process, and I don't think it's got further implications for Alderney.
Thank you. I'm just seeing else. Matthew, you've got your hand raised.
Yeah, there's a question for Dr. Brink about unknown community seeding. How many cases of unknown community seeding have been traced back to a source now, or I guess been solved?
So as I said, we've got our source tracing and our contact tracing. So, for example, the 8 cases that we had yesterday, 3 of those are at the moment unknown, but we think they're linked to a source. So only when we analyse through that whole process, we'll be able to give you exact percentages. But the figures that we've delivered on a daily basis are the updated figures of unknown community seeding, with the caveat that some of those are linked to known sources. I think from our perspective, we always err on the side of caution. So we want to make sure if there's anything unknown about a case that we do the maximum to test around it, to contact trace around it as broad as we can to extinguish those pockets of infection.
Thank you. We're now past 2 o'clock. So I think one more question from everybody, if they want to ask one. They don't have to, of course, if they don't, but you got your hand up. So what's your question?
A question that might slightly contradict itself, but some members of the community looking to start non-essential deliveries lead up to Valentine's Day, for example, and sort of to add to that, some people questioning edge. because hedge veg stalls obviously are attracting large amounts of people who might be touching hedge veg stalls and the cash boxes, that kind of thing, to transmit it. But then also some people are saying, well, we can sell our non-essential items there. You can see the conundrum.
Indeed. Heidi, do you want to deal with these part of that?
Yeah. In terms of non-essential deliveries, yes, as we said in the opening part, that is allowed now, so long as people do so by themselves, deliver by themselves, don't have any contact with the public. In terms of hedge veg, yeah, I mean, I've been surprised by how many things that are now able to be sold by hedge veg and the interpretation of veg, which I thought that's what they were there for. But people need to make their own decisions on that.
Yeah, be careful is the answer, because remember, it's physical contact, touching something that you can pick up this very contagious form of the virus. Who else has got their hand up? Matthew, I thought you had your hand up, but then you went quiet. Have we got no more questions?
I have a question I was kind of forming, but it was from a member of the public, so I'll try and get it out. We're kind of looking for another message of reassurance, because we've had a couple of a few elderly couples, concerned members of the public, who are cleaning all of their delivered shopping and even leaving their newspapers 3 days before touching them, because they're concerned of, the virus being passed along on items. Is there any words of reassurance for these people?
Dr. Brink.
Yeah. So I think the important thing is when you get a delivery and it's that hand hygiene and then not touching your face. It goes back to, how do you get the virus? It's either through direct contact and touching your face, or else through respiratory transmission. So it's going back to your first principle. So what I would say to people is wash your hands. So unpack your shopping, wash your hands. So it's that basic good hand hygiene that is so important when we come to combating the virus.
Thank you. I can't see anybody else's hand up, but it may be that yours is, Hamish. As I say, we've got a technical, or there's on my screen. Have you got a question, Hamish?
I wondered if there was any update on the initial care home case, on the patients themselves. I know Deputy Berard said they were healthy, but in terms of when they can expect to be moved back to their care home.
So we'll move them back after 14 days. So after we've done the period of isolation, but also the main reason, if you recall, that they were moved up to the Princess Elizabeth Hospital is for care. So none of them require clinical care. They were just moved up for safekeeping. So it's all based on when the home can be safely staffed again. And that's when all of their carers have done the 2 weeks of self-isolation, or if they were positive, they've recovered. So it's all about safety and providing optimal care under these circumstances. I'm
going to draw it to a close there. Thank you very much again to the media for wide-ranging and good questions. Thank you, all members of the panel. We'll be back again on Friday, and we are moving out of this. We are making considerable progress. We've still got a long way to go, but we're going in the right direction. So be vigilant, and then we can all be happy and safe. Thank you very much, and see you Friday.